If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. I hope everyone had a healthy, relaxing summer. This is our 12th season, and it's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call our live phone line at 718-499-6101. Also, you can now email your questions during the show to asktthedoctor@netny.net, and we'll bring them into tonight's discussion. For this episode, we have Dr. Anna Saponia, internal medicine attending at New York Methodist Hospital. Then next to her is Dr. Daniel Stevens, laparoscopic surgeon at Metropolitan Hospital. And then we have Dr. Montgomery Douglas, chair of the Department of Family and Community Medicine at the New York Medical College. Welcome. Well, it's been a busy news summer, and I thought we'd bring you some of the highlights of the year. And the first one is that weight loss, which everybody thinks is good, may actually not be good for you and may cause you some harmful effects. And a study showed that normally pollutants, when we breathe them in and they get in our bloodstream, they get stored in the fat and they don't get into the organs, into our vital organs. But when you lose weight, they begin to break down the fat, and these pollutants get into your organs, and you may get diabetes, heart disease, rheumatoid arthritis. So we don't know exactly what to do with this, how serious it is, and we definitely don't want to tell people to not lose weight if they can, but this is interesting, losing weight under controlled supervision may be the way to go. Now, smoking. Smoking has not changed in the past 6 years. 21% of people are still smoking, something that I find hard to believe with all the educational material, all the taxes, that it's now like $10 a cigarette, and people are still smoking. And what's scary is 98% of children who live with smokers have harmful products in their blood. So you're doing this to your children, not just to yourself. And if you take all of our school children aged 3 to 11, well, more than 50% are having these pollutants from the cigarette smoking in their blood, even if they don't smoke or live at home where people smoke. So we have a long ways to go, and maybe we'll get into that discussion later in the show as to why this is happening. Now, memory problems. Who has more memory problems, men or women? I forgot. No. But the answer is men have more momentary problems. Now, you guys out there, you parked your car somewhere, you can't remember where it is, right? You ask the wife. You leave your keys somewhere, you can't remember, you ask your wife. Turns out women don't have these events as much. And what's a little scary is that 15% of the people who are having these momentary memory lapses actually may go on to develop Alzheimer's. So it's very important, if you're noticing more and more of these, to get in, see a doctor. If you forgot his number, ask your wife and she'll tell you. And then you get in there and take Aricept, or medication may be helpful in the long run. So it's not hopeless, but be on the lookout for that. Now, another one. Children under 5 who don't sleep enough are more likely to be obese later in life. It's kind of surprising. And they can't make it up on a nap. It's got to be 8 hours of sleep or more at night. So this is a modifiable, something we can change about becoming obese, even better than doing eating habits, but developing proper sleeping habits. And it seems that the window is from 0 to 5. So that's the time. If you didn't do it by 5, there's not much you can do. Now, the flu shot last year kind of fizzled out with all this talk of flu, and a lot of people are saying, I had it, I'm not getting any more flu shot. What percent of Americans do you think have gotten a flu shot last year, in a hyped up year? 32%. That means under half of Americans, with all the talk about the flu and the swine flu and all this, H1N1, 32% decided to get it. It's something, though, that everybody is affected with complications, no matter what age, and everybody 6 months to adults should be getting it. It's a safe shot, and you're actually helping to protect people around you, young children and elderly who are affected even more. So even though we got faked out last year, and in the past there's been a lot of boy who cried wolf, it's worth getting the flu shot. It's available. And if you're older, ask about the super dose. It may give you a greater immunity than the regular dose. Ask your doctor about the super dose. Now, under the category, there's a sucker born every minute. If you ever had this ginger ale, let's say, that's laced with green tea or vitamin C, and then it says antioxidants, drink this, it's going to keep you young forever. Well, the FDA got very upset about this because there's no proof that the green tea they lace into that ginger ale does anything, the vitamin C doesn't do anything, and they feel it's a bad habit trying to fake people out by giving them junk food and saying this is going to make you feel better if you take it. So some big fines are at hand. The companies have a lot of explaining to do, Lipton tea, and I forget the ginger, Canada Dry. So we have, no, they win, but I'm telling you that this, the FDA is really concerned because it sends the wrong message to people, okay? Now, that's it for in the news. So kind of interesting in the news for the summer. We scour all the newspapers, you know, we get you the news, so. Now, New York City, the summer. I mean, I think it's the best time. People are out of town, it's quiet, you walk around. We met so many listeners of this show and the tablet. It's been a pleasure to meet you, and I look forward to, you know, continue watching the show. Just to recap my summer, because I know Manchester, Vermont, we started with Lou Carnesecker and his wife Mary, the famous basketball coach, and Pat and Catherine Gassafi, who we go up there and shoot, and the wives go shopping, and amazing shoppers, that, particularly that Mary Carnesecker, she can find a deal that, you know, it's just amazing. So we wish them well, and we had a great time. And then we went to Cape Cod with my new grandson, Nevin is his first name, and we stayed at the Chatham Bars Inn, and it was just an exciting event. And that was probably my exciting event of the year. I don't know if we have a picture of Nevin, but I think he's up there. If you know, you'll see him being up there on your screen. Monsignor Bennett, Monsignor, thanks. 12 years, hasn't missed a show. You see him out there. Monsignor, we'll get together. We go to brunch at the River Cafe once a month on Sunday, and it's a tradition that continues to go on. Thanks for coming for the show. We have a sad moment to talk about. A loyal listener and a wonderful person, Angela Rowland, who lived in our community, watched this show, helped to raise her granddaughter with her daughter Mary, worked in Methodist Hospital at many different jobs for 15 years, had 8 grandchildren, 4 children, and she was quite a fighter. You know, they just don't make it like that anymore. She had a serious illness, was told she wouldn't have very short time to live, days, weeks, and last 3 years, fought this thing, never complained, helped out her granddaughter, her husband, her daughters, and it just, it's somebody that she didn't feel sorry for herself. She was tough and fought it out. So I really would like to have a moment of silence because we really will miss her, and we tell her family thank you for, you know, sharing her with us. Okay. Now, just tomorrow's the first day of school. I have a couple of loyal listeners who are actually school children, the Vivian Bubel's children. Christian is 9 and Bradley is 12. They'll be going to St. Saviour's tomorrow. I know it's a lot of nerve-wracking trying to find the little memo pad that they tell you to get and the 3-inch loose leaf, and there's always some kid that bought them all out so you can't get them in the store. The Pachotas, if you pull them down, there's Brittany, I know, is one of the children, and Rebecca is the other, and they'll be starting school tomorrow as well. So anyway, just to wrap it up, the highlight of my summer was the birth of a grandson, Nevin. We'll find out with the audience what our guests are, but we'll get back to that in a little while. Now, the quiz. And our quiz master, Linda Lapatos, is back, well-rested, and she came up with, I think, a kind of interesting quiz. What is the most common name in the Bible? It's shared by 32 people in the Old Testament and 1 in the New Testament. So there's 33 people with this name. I don't know, it's a very tough one, I think, but when you hear it, you may kick yourself, okay? So we're going to take a short break, and when we come back, we're going to meet our panel. We're going to go to your questions with topics again, internal medicine, surgery, and family medicine. Now, the number to call, 718-499-6101. And you can also email your questions to askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are internal medicine, laparoscopic surgery and general surgery and family medicine. Now, before we get to see who our first caller of the year is, I want you people to know who we're dealing with, but these are no strangers to you. They've all been here on previous shows. Dr. Saponia, how are you? Thanks for being with us.
Very good. Thanks. Thanks for having me.
So we're talking about the summer and what we did. What was the highlight of your summer for relaxation?
It was just a recent vacation to Rhode Island, to the beaches of Rhode Island. Very nice family time.
Was it cold?
Water was cool, but it was hot weather and hot air, so it was a very pleasant experience.
Very good. So you're all rested and ready to go with these questions. I know we got some emails already. And Dr. Stevens, it's a pleasure to see you again. You had a restful summer, I hope?
Not too restful. We had a boy, our
Whoa.
first boy. So
amazing.
sleep is hard to get these days, but we're very happy.
Well, this is something. Any tricks that he can do?
He's sitting up now.
Whoa, how old?
3 months.
It's amazing.
Amazing.
Well, not to make this a Maury Povich show here, but for those wondering if there's any link, there is a link between Dr. Stevens and myself, but we don't need DNA testing on this, that he's married my daughter, it turns out, and the baby has a connection to 2 people, so playing guys, but it's a pleasure, yeah. You didn't know that, did you?
I didn't
We
know.
had to let the secret out. There was talk around the business about this, there was all the talk, but that's the truth, and nothing bad. But it's been a pleasure to, you did a great job. You couldn't have done a better job.
Graduation on 12 seasons.
Thank you very much. Now, we'll move on to Dr. Doug. You didn't have any kids this summer, did you?
No.
No, okay, Dr. did not have any. I don't know if they're going to put up another picture up there or something or what. So, what was did you go to Dominica at all?
No, I didn't go to Dominica this summer, but I actually moved. And you know, moving is one of those things they say that it's like listed among the most stressful things. And it was so smooth because my wife actually likes to pack.
Ah, that's how you do. You get the wife to pack, carry out the luggage, and it's smooth. That's the whole thing. She likes it.
So it actually turned out I was expecting the worst, and it ended up being so smooth that actually it was actually fun.
So
Can
you moved
imagine?
out of Long Island?
Out of Long Island into Westchester,
where
New York Medical College is. It's located in Valhalla, Westchester.
Much more convenient.
So
was that going to sell? That they were going to sell the school, but they didn't.
There was a merger that they were contemplating, but it ended up not happening. So.
And we had a great dinner together. Dr. Douglas and his wife, and myself and my wife. We ate at Piccolo Venezia.
Exactly.
That was we had a great time.
Excellent. That was excellent.
That's in Astoria. So anybody
Astoria,
wants to go.
exactly. Yeah.
And we're still waiting to hear the reciprocation if Dr. Douglas asks us back, but I know it's going to happen soon. So anyway, now who's the first caller of the year? This would be a trivia question out there. The first caller and Ask the Doctor 12th season. Hello?
Hello.
Who is this, please?
It's Mrs. Mara.
Maddie, how are you?
Oh, I'm hanging in.
You've been under the weather, I heard.
Yeah, I fell and that was it. I was in the hospital and now I just feel a little lightheaded. Today, though, I felt a little better, but why should I get lightheaded?
Yeah, Maddie's about 80 years old, right?
I'm going to be 90.
90. I like to keep, for insurance purposes, we like to help her out on this. But 90?
I'm going to be 90 in January.
Maddie's 90 years old, feels well, except there's lightheadedness, and it's interfering with her going outside in the street to do shopping and so on. Any thoughts on dizziness in a 90-year-old?
I'm thinking of Maddie. Are you taking medication?
Yeah.
What are some of the
Don't
medications?
ask me what it is, but I'm just taking it.
I know she was taking the non-drowsy Dramamine or Meclizine. She was
Yeah,
taking.
well,
Oh, you take that
mean,
for dizziness?
I mean, I feel, better from what I was,
Yes. And what else are you taking?
And then nothing much.
Oh, you're pretty healthy,
And
man.
it's 3 pills.
3 pills. You know,
Yeah.
medications are a very common cause of dizziness in older patients. So
Right.
that would be the first thing I would think about. Not that you stop it, but that, it's one of the things that can cause dizziness in older patients. Sometimes getting up quickly is another thing that can cause dizziness. And then I wonder, what is it, a lightheadedness type of thing or a sensation that you're spinning?
I had it, but I don't seem to have it anymore.
Oh, you don't have it anymore. Great then. Okay, so it went away then.
Yeah.
That's wonderful.
Maddie, we're great to have you back as the first caller in the 12th
Yeah.
season. We look forward to hearing you
Yeah.
call each week.
Yeah, good luck, Doc.
Thanks a lot, Maddie. Be well. Let's go now to Grace. Grace? Grace?
Yes.
Hi, how are you?
Yes. Well, I had a little episode this past Friday. I had some chest pain, like it feels like stabbing in the muscles of my heart, and a pain radiating to the back, like my
Grace, can you
shoulder
talk up a
blade.
little bit? Come a little bit closer to the phone.
Can you hear me better now?
Yes, much better.
Yeah. It was like a stabbing pain that was coming like in pain in my heart, and my shoulder blade in the back radiated to. We went for breakfast Friday at the King's Plaza Diner, and I didn't hardly eat right. And I told my husband on the way home, "Don't go home. You better take me to a hospital. I don't feel well. I got terrible pain, stabbing in my. I feel like
We're going to get to that. We're going to get to that. How is the King's Plaza Diner?
Yes, it's good.
Okay, now, Anna, can you address that? How old are you, Grace?
75.
She's 75, had this kind of pain, stabbing pain, going through to the back from the
Yeah,
chest.
so we went to an emergency room at King's Highway Beth Israel Hospital. I landed.
Okay, let's hear what we think. What
Yeah,
goes
they
through your
said it
mind?
was musculoskeletal chest pain.
Okay. Grace, I want you to listen to Dr. Saponia and then Dr. Stevens is going to weigh in on what might be causing chest pain.
Yeah, it sounds in your case, since probably in the emergency room they ruled out any causes of cardiac disease. It might be acid reflux. So the pain that you experienced in the left side or in the middle of the chest goes to the shoulder blade, stabbing character. It's like very common symptoms of the acid reflux. And there is medications that you can help to reduce this acid production. Doctor definitely will tell you about this. This is most common reason if you ruled out cardiac reason. And the second is atypical chest pain because of the musculoskeletal reason, like pull the muscle, pull the tendon. So for that reason, you just take Advil, some medications, or maybe some creams, which is, alleviates pain in that area. And I think in your case, it's probably, you have to be on a diet for acid reflux first and to take medications.
Dr. Stevens, anything surgical or?
Well, I think it's good, Grace, that you went to the hospital. It could have been serious.
Take Advil.
Yeah, it could have been a heart attack, which you obviously knew it could have
But
been.
that
So you
was
went to the
ruled out.
hospital, and they made sure it wasn't anything serious. So that's good news. But you should still be aware that if it happens again in the future, it's still maybe your heart, maybe something else. So if it's real serious again, you still need to go to the hospital. But as Dr. Saponia said, it could be acid reflux. It could just be you pulled a muscle. But just keep aware and stay healthy.
It's great to have you with us, Grace, for the opening show. And we hope to hear from you throughout the year.
Yeah, I'm thinking about that. The answer to the thing, would that be David?
David. Now I'm supposed to throw it to the judges. Judges, is it David? Okay, I don't know if that's indigestion or what you're hearing there, but it's not. There, you heard it. It's not David. Not David, but it's a good guess. Grace?
Yes.
Be well. Let's go now to Mrs. Mahoney. Hi, Mrs. Mahoney.
Yes, I just want to comment about your facts about smoking.
Yes.
Do you think it has anything to do with the depression people experience, like with the shopping for jobs, the possibility of moving into with their in-laws, the regular economic?
That's an interesting thing. Does this
I think-
time of stress cause
Yes,
people to
yes.
smoke?
Yeah, every resort to their old habits.
I like that thought. What do you think, Dr.?
I think it definitely could be part of the factor. When people get stressed, they pick up bad habits, they start smoking, they find it more difficult to quit smoking if they've been trying to. So I think the economic problems that we've been having definitely aren't helping, although cigarettes are expensive now, I think, so it should help.
Dr. Douglas?
Well, the other thing is, what you said was that the rate of smoking remained the same for the past 6 years. So even before the recession, which started 2 years ago, if you recall, the smoking rate was 21%. So I'm sure that it's multifactorial, but many kids smoke also, and there's advertising to kids and other things that keep pushing up the rate. But the good thing is that it didn't get worse, and it's much lower than in Europe. So we have something to But we have to continue to push to try and reduce the rate of smoking.
Anna, did you ever smoke as a girl?
I tried.
I know in Russia it was big time smoking.
Yeah, but I tried, but I didn't smoke.
That's good. What about your children? What do you tell them to get them not to smoke?
Oh, they just see that, I'm not smoking, my husband doesn't smoke, and...
Best example.
Yeah.
Best to lead
Yeah,
by
I
example.
think this is that.
Thanks for that question, Ms. Mahoney, though. Good thought.
Okay,
And
thank you.
be well. Now we're going to take a short break, get everything together properly here, and when we come back, we're going to be taking your calls. Now, the number to call is 718-499-6101, or you can get us on the email internet at askthedoctor.netny.net. So we'll be back in a short minute, so don't go too far. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor. And we have numerous firsts on this show. This is our first live email question that's coming in. Now, they taught me, I took a course actually just on how to do this. The question is from Bob, and he wants to know, he's calling from a 646 number. We can't tell where that's from, can we?
That's like a cell phone.
It's a cell phone, or 718, so somewhere in Brooklyn maybe, okay, or Queens. What action should one take to raise his platelets level? My platelets have been steadily decreasing over 2 years and averaging 126, averaging 126. So we want to know first, what are platelets? And then why might they be dropping, and then what we can do, right, Bob? So we're going to answer that. Why don't you listen?
Okay. Platelets are the blood cells involved in blood clotting. Okay, so they're important for clotting. Usually, the normal rate of platelets is 150,000 to 400,000. So the fact that you have 126,000, that's low. But it may not necessarily be cause for a lot of concern, because bleeding doesn't begin until you're well below, like less than 50,000. Some people even say less than 30,000. So basically the way the body works is like redundant. You have a lot more platelets than you really need. However, that's not something to ignore. If your platelets are constantly dropping for the past 2 years, it does need to be addressed. And the best way is to see a doctor, and he will do a bunch of tests to see why the platelets are dropping. Could be an immune problem, could be another disease that is affecting platelets. And so I'm sorry you're having this problem, but happily, it's not going to cause you to bleed right now at 126,000.
I hope that helps you, Bob. And anybody that wants to get in, this is another way to get in at the Ask the Doctor, netny.net. So now let's go back to our busy phone calls. We have Muriel. Hi, Muriel.
Hi, Doctor.
How are you? Have we heard? Is this your first call to the show?
Yes, I could never get through.
Yeah.
But this is a very important question. Please help me.
We're going to help you. What's the question?
My eyes hurt very, very bad, painful. So I went to the optometrist, and she sent me to get an MRI. And it shows that I have a tumor outside the brain.
Okay.
And they want me to do surgery. Now, my question is, they said that I have glaucoma, and now the tumor, I want to know if I can do the surgery with having that.
Mm-hmm. Did they tell you?
I'm a bit scared.
Okay, so she's got glaucoma and some kind of a tumor outside the brain, maybe a meningioma, and it's causing her pain in the eyes.
Yes.
And she's worried, can she have the surgery and the glaucoma, in spite of the glaucoma? And one of the things we like to know is what kind of treatment you're having for the glaucoma, what your pressures are. Is it being controlled?
But I have 3 medication I take for it.
You
One
take
is,
drops?
Pardon me?
You're taking drops?
Yes, 3.
3 types of drops.
Yes.
So, I mean,
What-
I'm going to let one of our panel weigh in, but I think as long as you have your glaucoma under control, that's
Yeah.
good. That's good. Anna?
I don't think it's any contraindication for the surgery. As long as your blood pressure, not blood pressure, eye pressure stays normal on eye drops, it's not contraindication. You have to proceed with the surgery.
Yeah, I agree, Muriel. I think it's important that you get this tumor in the brain or wherever it is. Maybe it's on the optic nerve. If you were having eye pain, it's got to be taken care of. The glaucoma, while it's important, as long as it's being treated, you can live with that for a while, take care of the more serious problem, and then afterwards, if you need something done more for the glaucoma, they can take care of that.
Oh, because I'm a bit scared. I know I have to do it, but
We're here to calm you down, Dr. Douglas.
Yes, you know, I know that well, I can imagine how afraid fearful it must be to actually have
yes,
not only eye pain, but a tumor inside of your head. So
Yes.
it's very scary, and you do have to talk with your family. You have to talk with your doctor. You maybe even want to get a second opinion. But whatever, you need to come to a conclusion about that soon, and see
right?
whether it's something that what needs to happen.
Yeah, well, half of my relatives said yes, and the other half said no.
So we have 4 people here tonight that say yes.
Yes?
Yes.
Yes.
Oh, okay.
So we want you to call us when it's done, and you're going to tell us how much better you feel.
Oh, I hope so. I am 74 years old.
Where are you calling us from?
From Brooklyn and Canarsie.
Canarsie, beautiful out there.
Yeah,
You know, you want to
what-
get out there, enjoy the pier and the water out there.
I hope so.
So get in there and get that done and give us a call back.
All right, I certainly will, and I thank you.
Take care, Muriel. We may have a quiz winner from what I hear from the producer tells us it's possible. Anthony?
Yes,
Now, I understand that you might have the answer to the quiz.
I'm going to try. I think it's going to be Abraham.
Okay, I want you to step back and just say one more time, then I'm going to ask the judges.
Abraham.
Abraham, what do you say, judges? Oh, my God. No, I'm sorry. It
That's
wasn't God
okay.
either. What? No, that's a good guess. Actually, Dr. Saponia thought it was Abraham, too. But it's not Abraham, but it's a big time, you know, it's a good guess.
Thank you.
Anthony, any question on the show tonight?
Actually, I just suffer from high blood pressure. A 35-year-old man who I'm actually on Norvasc for 10 milligrams, but I seem to, even with that, my blood pressure goes up and down on a regular basis. I was just wondering what
So
can I
it's
do best to keep it moderate?
Right, let's hear it. Dr. Saponia's on Norvasc, and yet it's still bouncing up and down all over the place.
It depends what fluctuation of the blood pressure we are talking about. Because definitely during the day, if you sleep, your blood pressure is supposed to be a little bit lower. If you are physically exercising, you know, you need to have more blood flow to the brain, and blood pressure is supposed to go higher. So we are talking about range of the blood pressure fluctuation. If it goes between 140, you would say, over 90 to 160 or 100, when you exercising, you know, then I might think that it maybe would be acceptable. But if range of the fluctuation goes between like 150 to 170, so that range is not acceptable, then you need to adjust your medications, go to see your doctor. Norvasc, by the way, it's very good medications, and you're supposed to either stay on this and add some medications to it, or if fluctuation in normal range, just maybe not even worry about.
See,
Thank
with
you
blood
so much.
pressure, right? Blood pressure disease that kills you over a number of years. Doesn't usually do it overnight. So you're a 35-year-old man. You
Yeah.
know, we want to make sure that your blood pressure is under control most of the time, so you're not going to have the damage, right? And so,
The thing I would add would be that most people need more than one medication to control their blood pressure. So I suspect that just Norvasc is not enough, that you probably need a diuretic or something else in addition to the Norvasc. And remember, blood pressure is not just medication, it's also stress management, it's also getting adequate sleep, it's also making sure you get enough calcium, it's making sure you stay away from salt, making sure you eat enough potassium in your diet. There's so many different things that go with managing blood pressure. Medication is just one of them.
Right.
thanks, Anthony. Thanks for the call. Hope to hear from you throughout the year.
Thank you, sir.
Take care. Now we have is that Franca or Franca?
It's Franca.
Franca, where's that from?
Italian.
Italian. Yeah, do you still have relatives back in Italy?
Yes.
And where are you calling us from?
I'm calling from Dyker Heights, Bay Ridge.
So can you give us now what your idea is of an excellent Italian restaurant?
I like Spumoni Garden.
Oh, that's with on a hot summer's night. Is there anything?
Wonderful. Love to sit out there and have the awesome pizza.
And what about the Italian ices?
Oh, definitely.
The best. You
Definitely.
eat little lemon chunks in it. It's just
Yep.
such one of the great parts of being in New York during the summer. So
I'm
what
sorry?
can Franco? What can we do for you?
Well, I have. I think I have the answer to the trivia question.
Oh,
and
wait,
I had
wait.
a cardiac question.
Oh, you have a cardiac. You almost gave me a cardiac question here with this. I didn't know anybody was going to come up with this so quickly. What's the answer?
Simon?
I'm going to ask the judges. Is it Simon? Oh, I'm sorry, Frank. I'm sorry.
Tough one tonight.
That's okay.
It's a tough one tonight, but Simon was a good one.
Yeah.
Actually, how many Simons do you know? I actually wasn't
I
that
don't
good.
know any.
No,
That's
it wasn't a good one,
uncommon.
actually, Frank. No. But what's the question?
Well, so try and make a long story short. I'm 39 years old, and I have genetic heart disease. I was born with IHSS, and I've always been followed up by a cardiologist, and been never really given any other alternatives as far as surgery was concerned. Always been on medication. So now, when after I got married and I was childbearing age, my condition, I guess, had gotten worse, and I had also ventricular arrhythmia. I needed a pacemaker, and I was pregnant at the time, and I refused to have the pacemaker put in because of the radiation while I was pregnant. So during a C-section, I went into pulmonary edema, and 2 days later, they put in a pacemaker, defibrillator, and after 6 months later after that, I wound up having to have a septal myomectomy because my septal muscle was so severely enlarged, and they had given up. They said when they measured the muscle, it was like 5 something, and they gave up measuring after that. So anyhow, they said after the surgery that I wasn't going to be needing any medication. I was going to be fine. I'm still symptomatic. I have a lot of other complications. I have myocardial bridging. I have asthmatic bronchitis. I have fibromyalgia. I have a couple of other, there's a few more problems that I have with my
and which
as far as the
medications?
heart's concerned. But I'm still symptomatic.
Right.
I'm on a lot of medications that I was on before the surgery. So I'm not sure if this is the right way I'm supposed to feel. If I'm always supposed to be this really, I can't function. I have a 4-year-old child, and I find life to be just a little bit difficult every day.
Well, man, we have the panel here. She has this obstructive heart disease that she was born with. She went into pulmonary edema, which is terrible breathing, lungs filling up with fluid, and she went through the surgery for this to relieve the obstruction, and seems like she's not better. What's going around? Anybody want to?
Well, it's a difficult problem you have, Franca. The IHHS, it obstructs the blood flow out of your heart and enlarges your heart, so it causes all sorts of symptoms, and it makes doing your daily activities difficult, and it makes every other operation more dangerous. As you know, you went into pulmonary edema, so. But cardiac surgery in itself is pretty dangerous. Not that there's not benefits of it, but you have to weigh the risks and the benefits. You've already had one surgery. So if you can manage the problem there with medication and you're able to live relatively normally, that may be an option. You don't want to rush back to the operating room, especially another second operation. So I would just recommend, depending upon how you're feeling, continue with the medications, see your cardiologist, follow with echocardiograms, and if it really gets intolerable, you may require another surgery.
Yeah, I have a feeling that in the long run, the end result, I think, is going to just be a heart transplant altogether. I don't know if it's going to be anything minor or anything. I don't think the problem can be fixed. I think it's just going to be, in the long run, I think it'll be open heart surgery. And I don't know if I'm a good candidate, if my health is strong enough to even be able to bear it.
Yeah, I mean, it's a tough one. It's a tough one. Obviously, you had a tough. You've been given a tough situation.
Yeah, there's a strong heart disease in my family. I have relatives, siblings, cousins, aunts, uncles.
How's your daughter? Or is
so far, she's fine.
Is she going to start school tomorrow?
Actually, she's starting late. She's starting the 20th.
Where's she going to go?
She's going to go to Our Lady of Guadalupe.
Very nice. You're going to bring those cupcakes up? I used to love that when the mothers would bring up the cupcakes. You do
Yeah.
that? So listen, enjoy what's good. Keep working on the situation. Make sure you're going to the best doctors at the best hospital. If you need a referral, we can give it to you if you want to give us a call, okay?
Okay, thank you.
Okay, thanks a lot. We now have another email question, and this is from Mary. Just came in, actually, a 68-year-old woman with systolic blood pressure that ranges between 115 and 125. My diastolic pressure is in the 50s. That's normally 80, so hers a little low. She wants to know if she should be concerned. She has no health complaints and she's active. And she doesn't want to give her name at this time.
How old is the patient?
She's 68.
68.
Her blood pressure is about 120 over 50.
Okay. With this blood pressure, I wouldn't worry about. And especially when you're aging, blood pressure 50, 60, it's kind of like a normal for that people because you have less reserves to keep your diastolic blood pressure at 60. 60, it's a low limit of normal. I see all my patients and, you know, it's very common. So if you feel okay on that blood pressure, if you don't have any symptoms of lightheadedness, you know, chest pain, dizziness, and the shortness of breath or anything, I just think monitor your blood pressure. And if it feels okay, 50, it's acceptable for diastolic blood pressure.
Okay, so Dr. Douglas, Monty, anything?
Yeah, I mean, many people would be happy to have that blood pressure, so I would not be concerned unless you're having symptoms, as Dr. Saponia said, lightheadedness and so on. So, you know, no, the answer is no, I would not be concerned unless you have symptoms.
Okay, we hope that helps you. Keep emailing us. We're now going to go to Irene, who may have the answer to the quiz. Irene?
Oh, yes, I'm here.
How are you? I can feel the excitement in the air here.
Wow.
But we don't know if you got the right answer yet, right?
Oh, well, I said Israel. I don't know yet. I'm waiting.
Okay, so I'm going to have you repeat that name and ask the judges what they think of that answer.
Okay.
Okay, judges, she says Israel.
Israel, yes.
Ah, and I thought you might have it. I had a little hint there of excitement, and I'm sorry about that. What do you think? I knew that was going to happen. This is too much pressure on somebody. Listen, if you... Hello?
Yes, I'm here.
No, devastated. You're devastated.
No, I'm not.
I hear it. I hear it. Okay. So, okay, but we want you to call back, right?
Okay,
you got to be in it to win it, as they say.
Okay.
You have any question?
Not at this moment. Thanks.
What made you think of Israel?
Well, I always notice when I read the Bible that Israel is always mentioned a lot.
Good thought for a guess.
Yes.
Usually mentioned as a land, but it could have been a name. It's not a bad guess. Kind of bad, but anyway, call back soon, okay?
Okay.
Thanks a lot.
Thank you.
Okay,
Bye-bye.
we're going to do another email now because we're really getting these emails are coming in hot and heavy. Okay, no name again. Doesn't want to put a name. Hi, I'm on Plavix and sometimes find my legs hurting when I climb the steps. Could this be from the Plavix?
I don't think it's from Plavix. There is a reason why you're on a Plavix. Most likely it's peripheral vascular disease, which is, condition gives you symptoms. It's called claudication when you have pain, on a walking. So if, I think probably you already seen the doctor and see if Plavix only treatment good for you. Maybe there is some surgical approach to some peripheral vascular disease to relieve obstructions of the arteries. So there is a whole approach to peripheral vascular disease. So if you're still symptomatic, it means Plavix, it's not, it's not right treatment for you.
Okay,
I don't think it's a Plavix. I think it's a condition that you're taking Plavix for.
Thank you. Okay, we're now going to go to Jesse. Jesse? Hey, Jesse?
Hello?
Hi, is this Jesse?
Yes, speaking.
How are you pronouncing that?
Jessia.
And pronounce it? Jessia?
Jessia.
Jessia, it's a beautiful name. Where's that from?
Well, I am from Guyana.
Oh, were you at the parade yesterday?
Huh?
You didn't go to the parade yesterday, did you?
No, I did not.
I heard it was beautiful. It was really.
I heard so too.
Millions of people, 3 million people on Eastern Parkway from the Caribbean celebrating heritage and different costumes and so on. If you haven't gone,
Yes.
it's worth going one year. Have you gone ever?
No, I've never been. I'm an asthmatic and I cannot really take heat.
Oh, and the heat and the close, right, the crowds, it wouldn't be good for you. Watch it on, it's on TV though, right?
Yes, yes.
Very good. So Jessica,
Yes.
what can we do
Yes.
for you tonight?
Yes, doctor, good evening to you all. I always watch your program. I missed it a lot.
Thank you, thank
because,
you.
Yes, but
You know
what
it's on
will
at
you
10
have-
in the morning, Jessica. It's on from
Huh?
10. It's on from 10 to 11 every morning.
Okay.
So in case you can't get enough of us in the evening, and it will be on every Tuesday evening.
Okay, thank
Okay.
you, doctor.
But let's hear.
What
So,
really,
what's the
what
question?
really happened last week? I got a cut on my just about my ankle, and I find it's well, it looked like it's drying up, but I don't know why it's hurting me. I don't know if it's the area.
Dr. Stevens, she has a cut on her ankle. It's not getting better.
One question just here. Are you diabetic?
Well, no, I'm not a diabetic, but I go to Long Island Jewish, and the last time the doctor told me I was at the borderline.
Okay. All right. So you just want to make sure that this cut is healing. Number one. If you're borderline if you have borderline diabetes, you may not be able to heal your wounds so easily. So
yes, the wound is not open or anything, but I step on a glass, and like I don't know if it punctured, but it had bleed a lot. That was last Wednesday.
Yeah, if it's still really bothering you, you may want to go see your doctor. They can get an X-ray, see if the piece of glass is still in there.
Oh, no.
You don't necessarily want to go take it out if it is, but it may just give you an idea. And there, maybe something else. There may be an infection brewing from the cut that you don't realize. Yeah. So if it's still bothering you and it's not healed, I would definitely go see your doctor.
Yes, Doc. Thank you.
And
one more question I had. I had a hernia. I had a hernia, and then they had fixed it. I had a hysterectomy done. It was on November, and they fixed the hernia the same time. But I find like my belly button, it's coming out back. I don't know if that is coming back or what, but
You've come to the right
hurting.
place. You've come to the right place. This is what Dr. Stevens can do better than anyone I know.
Yeah, it may be that, that your hernia is coming back, unfortunately. It can happen, especially after an incisional hernia, which it sounds like you had. The recurrence rate is pretty high, so it should probably be fixed at some point because your intestines and other things can get caught in there. So it's not an emergency, but at some point I would again go see your doctor. He can take a look at it, tell you if the hernia is back, and refer you to a surgeon.
Thank you.
Jessica, we hope that helps you out, and keep watching the show.
Yes, I always do. I love the show.
And give us a call. We want to know what happened. Okay.
Okay, thank you,
Thanks,
doctor.
Jessica.
Have a good evening.
You
Bye.
too. Now we have Sandra, who thinks she might have the answer to the quiz. Sandra.
Hello, good night.
How are you?
I'm good, thank you.
Somebody told me you might have the answer to the quiz.
Yeah, I'm saying it's Peter.
Okay, what do you think it is?
Peter.
Peter.
Yeah.
Judges, is it Peter? Oh, no, I'm so sorry, Sandra.
Okay, then.
You're sitting down. Again. Sit down. I want you taking deep breaths. Okay?
Yes.
Very good. This is how you relax, Peter. Yeah. So, and now that we didn't get the answer, but we can help you with a medical issue. Do you have any medical questions?
Okay, I am a diabetic, but I'm not taking any medication. I'm controlled by diet and exercise.
And the question is?
I would like to know how long do people normally control their diabetes with exercise and diet?
Okay, Douglas.
It has to do with how well you eat and how much exercise you get.
Yeah.
These are some of the other things that affect your blood sugar.
Yeah.
It also depends on your weight.
Okay.
Oftentimes, your condition could be much improved by losing weight, and then you may end up never even getting the diabetes.
That's
okay.
So,
how much do you weigh?
Oh, 180.
Oh,
and I'm 5 feet 9 inches tall.
Okay, so there's an opportunity there to actually forestall the diabetes. But generally, people get more and more diabetic tendency as they age. So that is what you're working against. So you would have to really take the weight down, you'd have to do the exercise, you'd have to decrease the amount of calories, all that you would have to do to be able to forestall the diabetes and just push it into the distance so that you hopefully will get it in a long, long time as opposed to soon.
Okay.
Thanks a lot. We appreciate your call.
Okay,
Take care,
thank you.
Sandra.
Have a blessed night.
Be well. Okay, now we're going to go to a break, but before we go to the break, I have a question, an email question to read off. Now, recently I keep getting bruises around my body, and they look weird. They never get dark, they only appear yellowish. And the question is, what is this? They don't hurt, they go away after 2 weeks. And she doesn't tell us anything if she's on medications or not, just that she's getting these bruises. Dr. Saponia?
I think it's a condition maybe benign, but you know, you need to see the doctor. And at first you need to see your internal medicine doctor, do your blood test, the blood count, and after that it might be that you need to see hematology and oncology specialist.
Any thoughts? Anybody else?
No, I think that's. Go ahead, Dr. Douglas.
She could be missing the black and blue, and then she's seeing only the yellow. It definitely, if it's only been going on for a short while, you might want to give it some time. You know, many times we get different symptoms that, you know, because it's short-lived, they go away by themselves, and we don't necessarily have to run to the doctor. But if it's bothering you, if it's getting worse, if it's going to be prolonged, then I would certainly go check that out. Yes.
I have good news for those on the thing. We don't have to take a break. Our sponsors are willing to waive the last break so we can get to the extra calls. So that's pretty exciting stuff. Yeah. Okay, let's see Arlene. Hi, Arlene.
Hi.
How are you today?
I'm very well. How are you, Dr. Garner?
Great. Do you have any thoughts on the answer to the quiz?
None at all. I'm sorry.
Can I give you a hint?
Yes.
The name of this person begins on the way on the other end of the alphabet from from the name that your letter starts with.
So I'm at A.
Yeah.
And the last part would be Z.
Okay. Now we're getting there. So it begins with a Z.
We have.
And I'll give you another hint. It's not one of those names if you walk into a bar where you're going to hear this name mentioned that much. It's kind of one of those old biblical sounding names.
Biblical name.
Biblical name.
I have to tell you the truth. I'm not a Bible reader.
All right. I can still save you. No, okay. Sorry.
You can save
No, we're going to work on this.
Okay.
Okay. So what can we do for you?
I have a question. I had hernia surgery. I had a right ventral hernia, and it was done the surgical method. And I had a very bad experience. I was in the hospital for 4 days instead of ambulatory. They weren't able to put the mesh in, and I developed all kinds of complications. Now I just found another hernia in my belly button, and I was wondering if it's possible to get it done laparoscopic instead of surgically.
Great. Where are you calling us from? Which neighborhood?
I am calling you from Bensonhurst.
Bensonhurst, great area. What do you like to eat, by the way, before we go to this answer? Where do you go out to eat in Bensonhurst?
Arios, Tommaso's, the Pearl Room.
Beautiful. Tuscany Grill or not?
Not really.
What about the one where the guy sings the opera? What's that one?
That's Tommaso.
Yeah, you like that one?
Yes, I love it.
Yeah, it's really nice.
I live like a block or two away from there.
Beautiful, beautiful. Let's hear from Dr. Stevens about this laparoscopic surgery.
Yeah, it's a great question, Arlene. You know, it sounds like with your first operation, it was done open, the traditional surgical way. And, you know, that's an excellent way to do the operation, but you can get increased chance of wound infection and recurrence and some things like that. Sounds like you didn't have too good of a, post-operative recovery. Yeah, it sounds like you have another hernia. It can almost absolutely be done laparoscopically, the umbilical hernia. It's just important that you find someone who can do it laparoscopically, and you'll still have some pain after. It is a surgery. It's not a non-surgical treatment. It is a surgery, but it's less invasive, and it's usually less pain after the operation, lower incidence of wound infection, and you should recover more quickly and easily if it's done laparoscopically. So, you know, if you have any questions, you can call us after, and we can help you find somebody.
Arlene, thanks for the call. The phone numbers are up there on the screen, and don't hesitate to call if we can help you.
I certainly will, and I thank you for the information.
Thanks a lot. Maybe I'll see you in Tomaso's.
Okay.
Take care. Let's go to Mary now, who may have the answer to the quiz. Mary? No. It may be a false alarm. It sounds like a false alarm. All right. We're going to move on. So those people who think they have the answer, hold on to your tickets. Don't rip them up yet. I used to hate that in bingo when that would happen. Okay. Eunice. Hi.
Yes.
Hi, Eunice.
Hi.
How are you?
Well, I'm pretty good today.
Where are you calling us from?
I'm Brooklyn.
Which part?
I live on 98th Street.
In Canarsie?
No, that's not Canarsie. That's like East New York.
Oh, yes. If you would take the, I know exactly where that is. Very nice. Any new restaurants popping up in East New York?
No, I don't know really. I always keep to myself here. I don't know what's going on.
Yeah, I think it's a resurgence actually, though. I think a lot of new places are opening up there.
Yeah.
Anyway, what can we do for you?
Well, I had back-to-back. When I said back-to-back, I had surgery for kidney stones in December, and then on April 28th, I had total knee replacement. And with all these things happening, I am a diabetic, and I suffer with hypertension. I would like to know if I need to have a companion in my life, but I'm so scared about that because I don't have no feelings for sex. So do you think it's because I have diabetes that causes that?
Can you just, are you worried about the lack of pain sensation?
Yes.
Yes, she's wondering if it's from a diabetes that her nerves, she had surgery for a kidney stone, but apparently doesn't always feel pain when she should be feeling pain. She wants to know if it's from diabetes.
Does she have diabetes?
Yes.
Basically, when you have advanced diabetes, then you can have the complications when you have numbness, which is called diabetic neuropathy. And are we talking about pain in the surgical area or general?
We're talking about, I think, general pain in the feet.
I mean, if it's a peripheral feet, it might be connected to the diabetes. But I think it's, you just need to see the doctor, do different tests on your nerves and to see if it's really a problem with your nerves. And maybe sometimes just, taking medications, and this is decreases your threshold of the pain.
Okay, I want to thank you for the call. We're just rushing along here because we might have an answer to the quiz from Irene. Irene?
Yes,
Hi. Now, is it possible you know the answer to this quiz?
I think it's Zion.
Can you please say that one more time for the judges?
Zion.
Zion. Oh, every time I hear those, when I hear the drums, I think you might have it. I would love to hear how it sounds when it wins. We haven't heard that yet. Are you okay?
I'm fine.
I'm sorry. Zion was a good choice. Again, it's not too, you don't hear too many first names of Zion in the Bible, right?
Correct.
Yeah, but it's a good thing. But thanks a lot for the call. Do you have any questions to finish up our show?
No, not really. Thank you.
I hope you have a great week, and I can't believe it because we're flashing away. I know the people must have the quiz. We're going to hold it over. We're going to hold this quiz over to next show, and we'll have two next week, two possibilities. Because I see so many people think they have that answer. It's a tough one. It's a tough one.
It is tough.
She's moving into the Z's, though, which is very good, very good. I can't believe how fast it went by. I want to thank Dr. Anna Saponia, Dr. Daniel Stevens, Dr. Montgomery Douglas for taking time out of their schedule to come in here. We hope that we were able to help you with the questions. We love to hear. It's your show. It's the only live talk show of its kind in the whole city, which is something. Any opinions on the first show, Danny?
I think it was a big hit.
Big hit?
Success.
And what do you think, Dr. Douglas?
I thought really enjoyable, really enjoyable.
And can I help? Anything from you, Dr. Saponia?
I just think, it's very nice to help people, if you're calling so many people trying to get their answers,
Well, it seems like, it is highly irregular, but somebody named Sasha is on line two may have the answer to the quiz. Sasha? Sasha? Sasha?
Hi.
Hi, Sasha. This is highly irregular. We're actually running over in our schedule, but we hear that you may have an answer to the quiz. What do you think the answer is?
Zachariah.
Oh my God! What? I have to go to the
Zachariah?
judge. Let me go to the judges. case you couldn't hear it, I think that was hooray and applause, a thunderous applause. Sasha, how did you get it?
My mom told me.
Wow, so you know what you're going to get now, don't you? Sasha, you're going to get the big plaque, the handmade plaque that only 13 people have in the entire United States. It's going to come with your name on it, hand engraved. It's a beautiful piece
Oh my God, this is so cool.
It's beautiful. Do you have any idea where you're going to put it?
In my room.
Oh, this is great. This is great. You show it to your friends. And thank your mother for that, for giving you that answer. We're very happy for you. First winner of the 12th season. Where do you go to, where do you live?
I live in Brooklyn.
Which part?
In Brooklyn, East New York.
East New York. Oh, we just had some. Yeah, we just had someone from East New York. Well, you're gonna love this thing, and we want you to call back, and we'll hear from you the rest of the season. Okay? Have a good night. I don't think she's going to be able to sleep then. You heard that genuine excitement in here. So again, now we're really tempting our sponsors here. They dropped one. We went over to the next show, but I really want to thank you for coming in and hope we're able to help the audience out there. Now, it's good to remember that you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or third opinions. And we'll see you again next week, in which we're going to talk about geriatric medicine, foot surgery, and rheumatology. It sounds like a good one. In the meantime, watch past episodes every morning at 10 a.m. to 11 a.m. Or you can visit our website at netny.net/askthedoctor. Here you can get my video blogs, the tablet column, podcasts, forums, any more, you name it. I want to thank you, Linda Lapatosa, our quizmaster, for putting up with me and for doing the great questions. Goodbye, stay healthy, have a great week, and I'll see you in the tablet.